Good afternoon, everyone. A very warm welcome to all our attendees joining us today for another insightful session by Onus Robotic Hospitals, Hyderabad. Today's topic is both fascinating and important. Half a smile? Let's talk about Bell's palsy. We'll be learning about what causes Bell's palsy, how to identify it early, and most importantly, how timely medical care can help you recover your full smile. We are honored to have with us Dr. Tejaswi Rao, Interventional Neurologist. Dr. Tejaswi is an expert in managing complex neurological conditions and has helped numerous patients regain facial movement and confidence after facial nerve paralysis. Before we begin, just a few reminders. You can post your questions in the Zoom chat box, and we'll take them up during the Q&A segment after the talk. We also encourage you to stay till the end to find out a short post-webinar survey. Your feedback helps us make future sessions even better. So without further ado, let's get started. Please join me in welcoming Dr. Tejaswi Rao for today's session, Half a Smile. Let's talk about Bell's palsy. Take it forward, doctor.
Hi, sir. Good afternoon. Thank you so much for the warm introduction. So I'll be discussing about Bell's palsy today. So commonly, basically half a smile, crooked smile. So let me share my PPT now. So I'm Dr. Tejaswi, consultant neurologist at Onus Robotics, and I'm a doctorate in neurology and a master's in general medicine. So what is facial nerve? Basically, to know what is Bell's palsy, you should know what is facial nerve. So you can see the right picture. So it is nothing but the seventh cranial nerve coming from the brainstem. Brainstem is nothing but the smaller and most vital brain. So from there we get a pair of 12 nerves. So one of which is facial nerve, numbered 7. So this is how it comes across the ear from the brainstem and follows the face and distributes over to the face muscles. So mainly responsible for facial expression, but not the only thing that it does. So facial expressions meaning being sad or happy, frowning. So we will know more about why and how it affects the face. So to know that, we should know what are the facial muscles, muscles of expressions. So we have multiple nerves. Keep an eye on the function of each and every nerve, so that when these are disrupted, the function is disrupted, that is the function which is going to go. So like, for example, frontalis. The frontalis muscle, all these muscles are supplied by this particular nerve on each side. So for example, if we get a deficiency in the functioning of frontalis, we'll not be able to raise our eyebrows or even wrinkle our foreheads. Similarly, if we have a difficulty or decreased connection of that particular nerve branch to nasalis muscle, we will not be able to flare our noses. And similarly, orbicularis oris, not able to smile or frown, pout or blow. So all these things once become deficient in case of a facial nerve deficiency, which is what is shown as symptoms. So facial nerve itself will have basically three supplies to the face, and not only the muscles of facial expression, but also a muscle which will go to the ear, which is a stapedius muscle, which will balance or move the tympanic membrane according to the intensity of the voices we hear. Another function is motor function, visceral motor function, that is, it supplies to the lacrimal gland and salivary gland. Nothing but helps in tearing and bringing out saliva in your mouth while we are trying to swallow. Also, another function is the the tongue sensations in the anterior two-thirds is also carried by this particular nerve. So when it comes to this nerve paralysis or decreased function of that particular nerve, it is not only going to be the face asymmetry, but also each and every function of it might be affected based on where the lesion is. So what is Bell's palsy? It's a sudden, more often than not temporary weakness or one side paralysis of face due to an inflammation. Inflammation meaning swelling of that particular nerve, which is a seventh cranial nerve. It is not a stroke, but many patients can mistake in it for a stroke. And more often it causes an unnecessary panic. But it is underdiagnosed as well as overdiagnosed in some cases, and we will be discussing about it in further videos. So in most cases, it is reversible, especially if we begin the treatment early. So how does facial palsy or Bell's palsy, commonly known, present as? So when the functioning or disrupted in the periphery, that is when the whole half of the face nerve supply is gone, and we get all the functioning defects in the lower full half of the face. But if there is another lesion appearing only in the brain, in such cases, we will not get another full half of the face deficiency. We get only the lower part of the face, weakness. So it's very important to know whether Bell's palsy is not just about the smile, it is about the whole face supply. Because sometimes it could be something serious or even a stroke. So what are the typical symptoms? Typical symptoms are sudden weakness of one side of the face, hence leading to a droop in the smile and a droop in the eyebrow and the eyelids. Difficulty closing the eyelids when we are trying to blink or even sleep. So they sleep with one eye opened and they are not aware of it. Hence leading to drying and watering of the eyes. The eye may become red if you're not treated for the next 2-3 days. Also, along with that, we have distorted taste. Like we discussed, the anterior 2/3 of the tongue cannot perceive taste anymore on that half. And there might be a pain behind the ear. Also, intolerance to loud voices because it also supplies to the stapedius nerve. Hence, we should be aware of all the accessory symptoms other than just the face symptoms. So these usually develop over hours and reach by 1 to 3 days. How to differentiate from stroke is to know that stroke happens very suddenly, and I'll be discussing other features soon. So it happens. Why does it happen? The common theory is that there is a viral reactivation which happens in the ear, commonly the herpes virus. So this causes the swelling of the nerve within that narrow bony canal through which it crosses. So from brain, it crosses through the ear canal and then comes out in the face. So while crossing through that narrow canal, in case there is an inflammation, causing a swelling of that nerve, hence causing decreased functioning of it. So once the swelling is gone, that is when it reverses. So that is why, because we are not expecting a cut-off of the nerve functioning, which is why we are hoping that it will recur. So that is how we should know whether it is functioning, is improving over the next few days or worsening, to further evaluate for extra causes. What are the common risk factors? So we regularly see in pregnancy, especially the third trimester, because of the lot of changes that happen in that trimester, commonly also associated with an upper respiratory tract infection where your immunity fluctuates and your ear, nose and throat are altogether affected, where it can help reactivation of this particular thing, and otherwise that itself can cause swelling of all the nerves. Diabetes patients are at risk. In this case, it is not really going to be the swelling of that nerve. In this case, it's going to be the microvascular damage of that particular nerve. They may also have other nerves when it comes to diabetes. Autoimmune disorders, nothing but our immunity has gone haywire and forgot where to target and randomly targets our own body. So there are multiple diseases when it comes to autoimmune disorders where one of the symptoms is Bell's palsy. It's not the only symptom. So how to differentiate? Where are the other diseases? So like we discussed, there could be a stroke also. Autoimmune diseases like GBS, multiple sclerosis, metabolic diseases like diabetes. There are a lot of bacterial, fungal, viral, and rickettsial infections which can happen in the brain and around the brain fluid, which can obviously affect any nerve coming out of the brain. One of them, and commonly because it has to cross across the ear, could be a Bell's palsy. And other diseases like tuberculosis and sarcoidosis, all these can cause, starting with Bell's palsy, but they may also have associated other symptoms. This is the same causes for Bell's palsy. So differential diagnosis also to make sure that this is not just a simple recoverable Bell's palsy. We should know the other clues. So it's very important to not underdiagnose it. Like we discussed, not to overdiagnose and not to cause panic. We should also not underdiagnose because there are a lot of tumors, especially the parotid gland tumor or a skin tumor or the ear tumor or the facial nerve tumor itself, the sheath tumor of the facial nerve. They also will obviously present as a functioning deficit of that particular nerve. But however, knowing how it presents and over what period it presents and what are the associated symptoms, you can always differentiate between a Bell's palsy and this. Whether to really go for an aggressive evaluation for this particular patient is totally individualized and should be taken an expert neurological opinion before ignoring it completely. So for Bell's palsy, it is nothing but the peripheral nerve inflammation. So in this case, the diagnosis is 99.9% clinical. Unless we are suspecting another cause for the Bell's palsy, we do not really ask for an MRI. We would only if they doesn't recover or if they have any other symptoms or signs associated with the other causes of Bell's palsy. And where is it misdiagnosed? Like I discussed, that 3.8% there are proven cases with an occult neoplasm. Neoplasm meaning the tumor, which was missed in these cases. And you should be having a high suspicion for these when you see there is a progressive symptom. It involves adjacent other cranial nerves, like face sensations are gone, the hearing is gone, and things like that. Vision is gone, and it is not reversing or it is progressing. And if it is associated with severe pain of the face or there is a skin change, all these things should cause a suspicion and needs further evaluation. For general Bell's palsy, the good news is, like we discussed, it's absolutely reversible even without treatment. Some of them do recover, but definitely treatment and diagnosis is very important to rule out other things. And by 3 months, with the proper physiotherapy and care, I think the patient should be able to smile properly. Earlier the better. So common treatment is usually steroids because they decrease the swelling, and antivirals, assuming that they are the reactivation or the virus has caused it. Eye care, because we cannot close the eye. Hence, just because of not closing and getting exposure to moving air and dust will further damage the cornea. So this is going to be just a preventive thing for the eye, as a collateral damage should not occur. But otherwise, for the facial palsy, eye care is not going to directly treat it. Fourth, physiotherapy. So facial stimulation by massage or physiotherapy or acupuncture, and can all help. Even robotic rehabilitation might help it to just give a signal to the brain that this nerve is needed by me and I need my spine back. There are other options like plastic surgery and facial reanimation, like lifting your eyebrow or eye lift. These are done only in cases where the recovery is incomplete or it is associated with some other diseases which are not treatable, or nerve grafting. And last but not the least, in case that there is a significant compression of the bone canal, which we were talking about, we can go for a decompression. We can remove the bone, a little part of a bone where the nerve can actually breathe even when it is swollen. So in that situations also, we can go for a decompression surgery. So common myths are that it is caused by a cold wind. Then absolutely not. It is caused by nerve inflammation, mostly viral, and some other cases it is actually some other disease itself. And the second method is permanent. No, 80 to 90% of Bell's palsy is completely treatable. Only if Bell's palsy is misdiagnosed and from something else, only then the treatment may not be 100% as what we are expecting. And home remedies alone are enough. Okay, they are not only enough, because sometimes steroids and antivirals are required to prevent further damage and delay in the recovery. So more important than the treatment, it is important to evaluate the cause to not miss a serious etiology. So take home points. So recovery is usually around 3 weeks to 3 months. The lucky people get recovered within 3 weeks. However, delayed treatment associated with diabetes or complete paralysis at the onset looking like a stroke, all these will have delayed treatments. We encourage general facial exercises like smiling, blinking, whistling to stimulate the nerve reactivation. This is a part of the physiotherapy as well and makes you feel good too. So recovery is almost a rule. It is not an exception if it is a simple Bell's palsy. So this is how we diagnose. We find the risk factors, we treat the cause, we diagnose, and we manage. So Bell's palsy, recognize, act fast, treat, exercise, and recover. Thank you.
Thank you, Dr. Tejaswi, for that highly informative and insightful presentation on Bell's palsy. It truly helped us understand how early detection and timely treatment can make a big difference in recovery and confidence. Now, we'll move on to our Q&A session. We've received some interesting questions from our participants in the chat box. Let's take a few of them for Dr. Tejaswi. So the first question to you, doctor, is how soon should patients seek medical help for the best chance for full recovery?
So because it is also a symptom when it comes to stroke, so it is within 60 minutes. So within 1 hour of this onset, it is better to see a doctor and make sure it is not a stroke. because beyond 4 hours we cannot do anything about the stroke. So keeping that in mind as a first possibility. So once it is ruled out that it is not a part of a stroke, then you can go ahead and take care of the rest of the medications at home for 3 weeks. But that 1 hour is called a golden hour when it comes to stroke, and we should not miss something serious, assuming this is just going to be a Bell's palsy.
Thanks for the answer, doctor. Are there any long-term effects or chances of recurrence once someone recovers?
If it is a simple idiopathic Bell's palsy happening because of a viral reactivation, it is usually once in a lifetime situation and not even everybody gets it. So the recurrence or progression is very, very rare when it comes to Bell's palsy. But when it comes to diseases like diabetes or sarcoid, where the etiology or the reason for this to happen are different, or even the tumors or brain tumors, brain infections, it appears to be a sign of those diseases. In those cases, it is not only very high chance of having a recurrence, but also the second time is going to be much worse and very less chances of full recovery. So in those cases, if second time Bell's palsy happens, it's very important to take it at most what do you say, urgency, because within the last 10 days, I think I've seen 3 patients who had the second or third time of Bell's palsy. They've been treating themselves with the same prescription which was given to them prior, and unfortunately, one of them turned out to be a brain tumor. So I think it is very important not to ignore it at least the second time.
Thank you, doctor. Another final question over here is, excuse me, what are some common myths or misconceptions about Bell's palsy that you often encounter?
Commonly, they think it is only the face expression, and some of them get over panicked about it and they think it's a stroke. And they come for treatment as soon as possible and they expect it to recover within a day. Unfortunately, the good habit amongst it is, yeah, coming to the hospital early is good, but expecting it to recover within a day or two with one tablet, it's not going to happen. It needs some patience, it will take time. That is one common myth. Other thing is only having every face weakness or every smile being crooked is Bell's palsy. So it's not, because there's a division of nerve supply that is coming through the face, and the origin of it is different from brain and brainstem. So to know that subtle difference is usually a neurologist's job, and it is important to know where the facial nerve is actually affected. Is it peripheral or is it central? And to rule out a cause is very important. And the third thing is taking care of the eye. People think it is only the face and they won't be able to sip a tea or brush and spit out or even use a straw. That is the only difficulty, is what is well known across, but not able to close their eyes while sleeping is very important. To be aware of it and to patch your eye when you're sleeping until this recovers, because in this process of recovery you're just going to have a collateral damage on your cornea, which is going to cause a permanent blindness. So you should be aware of these things to know. Also the taste is also a part of it. So knowing about what the nerve is and where is it coming from will maybe give an idea to patients about what all to expect if this happens and when all to see a doctor.
As we come to the end of today's session, I'd like to thank Dr. Tejaswi Rao once again for sharing her time, knowledge, and expertise with us. A big thank you to everyone who joined us today live. Your participation makes these sessions truly meaningful. So before you leave, we kindly request you to take a few minutes to fill out the post-webinar survey that will appear on your screen right after the session. Alternatively, you can also fill it from your email. The link could be there as well. Your feedback helps us improve and bring you more impactful health awareness programs. So stay tuned for our upcoming webinars by Onus Robotic Hospitals, where we continue to simplify complex health topics and promote preventive care. So thank you once again for being a part of the session. Take care, stay happy, stay healthy, and keep smiling.